B syndrome. Ancient theories and modern concepts. How does pain happen? Stagnation causes pain. It is a statement that appears frequently in this text. This is a restatement of the ancient ages that states where there is flow, there is no pain, and when there is pain, there is no flow. Still, this is somewhat incomplete explanation for pain. Why exactly does stagnation cause pain? The answer is simply that downstream structure are not nourished. This structure can be adjacent to or distant from the site of the stagnation. Boldly speaking, there are two causes of stagnation: excess and deficiency. In the case of excessive stagnation, the cessation to flow is immediate and profound. This gives rise to acute pain that is intense and sudden. This excess type stagnation can be from either an internal pathogenic factor such as phlegm or blood stasis, or an external invasion of wind, damp, heat, cold, or etc. In the case of stagnation due to deficiency, the cessation of flow is due to the lack of qi to fuse or blood to be fused. In either case, stagnation occurs. This gives rise to the chronic pain that is low-grade but chronic. There were many cases of blood stagnation where the tongue body's color was described as dark, dusky, or pale. Sometimes, these terms was left as they were. Other times, they were replaced with the term dim to approximate the lack of spirit that is found in the tongue color when the blood is stagnated. Dim in this sense is the opposite of vivid. There is a term in color photography that is used to describe the amount of ink in a color image. The more ink, the greater the saturation. The tongue body that has spirit will be syndrome, ancient theories, and modern insight. B syndrome is a common disease encountered in the clinical setting. B refers to blockage or obstruction. The meaning of B syndrome is divided into a broad and narrow sense. The narrow sense points to symptoms that are localized to one area such as limbs, whereas the broad sense applies to Zangpu organ type B syndromes. Symptoms of the narrow B syndrome refer to ache and pain or sensation of numbness and heaviness in the muscles, sinews, bones, and joints. Other characteristics include joint stiffness, limited range of motion, swollen or deformed joints, burning sensation, and muscle atrophy. The broad sense describes Zangpu organ disorder that result from a deficiency of right qi, after which mixture of wind, cold, dampness, or heat attack of the body to affect the channels and collaterals. This leads to an inhibited flow of qi and blood on systemic level. Traditional Chinese medicine teaches that B syndrome is caused by pathogenic qi blocking the channels and collaterals, and thus inhibiting the flow of qi and blood. Treatment principles include dispelling the pathogen, quickening flow within the collaterals, and alleviating pain. An ancient adage provides some insight into the best method of addressing B syndrome, especially when associated with wind. Regulate the blood flow first to expel wind. The wind may extinguish when the blood circulates smoothly. As such, medicinal that nourish and invigorate. The blood should be used when pathogenic wind is predominant, or the chronic process of the disease makes the pathogen enter deeply into the collaterals. If the B syndrome becomes a chronic condition, it can further inhibit the flow of qi and blood and lead to the accumulation of phlegm stasis. Another ancient adage teaches that when blood is blocked and transformed into stasis, Dampness congeals into phlegm. When phlegm is created, it becomes stubborn and more difficult to cure, as phlegm and blood stasis bind together to block the channels, collaterals, and joints. Etiology and pathomechanism. External causes. The main etiology and pathomechanism begin with an external attack by pathogenic wind, cold, and dampness. However, in the clinical setting, we classify B syndrome types boldly into two groups: pathogenic wind, cold and dampness, or pathogenic wind, dampness, and heat. B syndrome is most commonly formed when all three pathogenic factors, wind, dampness, and cold or heat, are combined to cause stagnation because of their mutually accumulative effects. Wind, cold, damp. Pathogenic wind is a young pathogen which easily penetrates the skin and enters ties, while pathogenic cold invades the muscle, tendon, and bones. When accompanied by dampness, wind and cold can more easily speak to the disease location due to the sticky nature of pathogenic dampness. When wind is predominant, there is migratory B, wind B, cold predominant, leads to painful B, and predominant dampness lead to fixed B, damp B. Wind, damp, heat. Wind and heat are both young pathogens. Wind can lead to heat, and heat reduces wind. Wind heat opens the skin pores and interstices, helping dampness invade, after which a more chronic condition can arise. Heat can form from pathogenic heat, a yang type constitution, or from yin deficiency generating heat. Internal causes. B syndrome results from pathogenic Qi attacking the body when upright Qi is deficient. Thus, upright Qi deficiency is the internal cause and the root of this condition. When the patient's long-term constitution is weak and Qi and blood become deficient, there arises a disharmony between yin and wei, where opening arises in the skin pores, thus allowing for pathogenic wind, cold, dampness, and heat and invade. They then block the flow of Qi and blood. The deficient upright Qi is unable to dispel the pathogenic Qi, which then invades deeper and is gradually retained in the muscle, joints, tendons, and bones. Thus, B pains linger and become chronic. Other causes. The initial stage of B syndrome is an excess pattern, but then it becomes a complex pattern of deficiency and excess because long-term exposure to pathogenic factors consume the upright Qi. Soon, B appears with symptoms of Qi and blood deficiency, liver and kidney depletion, or the appearance of the pathogenic Qi entering deeply into the Zangfu organs. Thank you for your attention.